So this is bonjour, hello. This is Dr. Amik from Unabridged MD. I'm your host, and we talk about all things health. And this is a podcast on hope driven by science. If you are in the Denver, Colorado area, and if you are looking for a rheumatologist, I'm still accepting new patients, and we would love to see you. We are the first direct rheumatology care in the area in Colorado. And what that means is that you don't need a referral. If you feel like you need a rheumatologist, I am she. And we can, of course, work with your physicians. And if you have a physician and need a patient to be seen by rheumatology, I am she. So you don't have to wait. And we take very good care of our patients, and we would love to see you. And today, I have the privilege of having on the platform Dr. Durowade. And she is an OBGYN. I'm going to have her tell us her story. And we are going to talk a lot of things, contraception, specifically in our patients' populations. So this one, you wanna listen, because there's going to be a lot to learn. And thank you so much, Dr. Durowade, to be on the platform. I'm going to have you introduce yourself.
Thank you so much, Dr. Ami. I appreciate the opportunity. Like you said my name well. Good job.
My name also gets cut sometimes.
How do I say the full name?
It's Dr. Isabelle Amig.
Amig.
Yeah, you got it. We don't pronounce the UES, but honestly, even in France, they do, so it's fine.
Dr. Isabelle Amig. I like it.
Thank you.
So I'm Dr. Durowade. I am a gynecologist. I practice in the South suburban area of Chicago, specifically Homewood, Illinois. I did general OBGYN for a few years, and then after that, I decided that I needed to step into my own space, create the kind of practice I wanted to work in, and serve my patients the way I feel they deserve to be served. And so that's how I started my practice, Dador Gynecology. So I mostly see gynecology only. I don't do prenatal care at this time. Hopefully at some point when I add helpers, other doctors, then we can do prenatal care. So just gynecology right now. And I love to educate my patients. I spend a lot of time doing counseling so that they are involved in the decision-making process. And one of the things I counsel about a lot is contraception, birth control. What's the right one for me? And so I'm excited to be here today to talk about it with you.
Yeah, thank you so much. This is so exciting. So the reason I was really excited to bring you on is that that's really some of the most, those are like questions. So it's really interesting. It's not so much questions from patients, because I don't think they realize. It's really questions from other physicians. And so my first question to you is, why is it something that we have to pay attention to? Why is it that contraception in patients with lupus and antiphospholipid, for example, we have to pay attention to this? And I guess I could also answer that question, but I'm going to ask you your point of view.
It's a great question, mostly because lupus patients, antiphospholipid patients, are medications that are not safe for pregnancy. And so we need to make sure that they have effective protection from pregnancy, so they don't get an unintended pregnancy and then real complicated risks with the pregnancy and with the baby. When they are ready for contraception, then, they'll talk to you. I refer them back to you and I say, talk to your rheumatologist, talk to Dr. Ami, and see if you're in a good disease phase where you can come off some of these medications and attempt pregnancy. So to prevent, damage to the baby, high-risk pregnancies, why contraception is very important for our patients.
Yeah, absolutely. And I think that's a really valid point. So We often say, please don't become pregnant for a little bit. And I remember this one patient, for example, she was like, no, I'm doing super well. Can I become pregnant? And I was like, give me 1 year, please give me 1 year. And she did. She has like
Oh, wonderful.
healthy babies. Like they're
Oh,
wonderful. But I was just
wonderful.
like, please. Because she was very, very, very sick before. She was
Mm.
finally sick and she was like so ready to have babies. And I was like,
Oh, bless
I'm
God.
not. You are. I am not. But
That's
then we were
good. I'm
both.
glad.
There's a third party now involved. It's not just
Right.
the partner.
Right.
But
Right.
yeah, that's really valid. So yeah, we can get you. We are gonna make sure that you are healthy when you are pregnant, and we want to make sure that everything is at the best that there can be. So there are contraindications for pregnancy, and of course that doesn't mean that your body is not going to become pregnant,
Mm-hmm.
but then that can lead to complication for you, for the baby, for the pregnancy. So we have a bunch of complications that we won't go into this, but you have to talk with your physician and your rheumatologist in that case. And yes, don't despair. We can get you pregnant. We won't stop, but it's better to talk so that you can plan it. So that's number
Absolutely.
one. And then can you tell us a little bit about why is it that like patients with lupus, for example, to take one, cannot just take any type of contraception? Like, can you talk to us about this a little bit?
Yes, absolutely. Because patients with lupus, especially those that might have positive antiphospholipid antibodies, are at increased risk of, blood clots. They're at increased risk of thrombotic events, high blood pressure, stroke, heart attack. And so we want to be careful in the type of medications we expose them to. Also, patients with lupus might be taking a medication that can make birth control ineffective or less effective. So we have to choose the right birth control that's not going to interfere with their medications and that's not going to make them at increased risk of complications like blood clots, heart attack, stroke, and things like that. So, for example, if you think about the birth control pill, that has estrogen and progesterone in it, or the birth control patch, or the birth control ring, they have both estrogen and progesterone in it. Now, if you have a lupus patient with positive antiphospholipid antibodies who maybe had a blood clot before, you don't want to put them on any of those, not any estrogen containing birth control, because that can increase their chances of another clot. Or even if they've never had a clot before, just because their disease is high activity, or maybe disease is very active, or they have, whether or not they have APLS or not, the chances that they can get a clot is too high when there are other forms of birth control we can do that wouldn't put them at that increased risk. So it's mostly because it can interact with their current meds that's keeping them, healthy, and it can also increase their risk of really bad things happening.
Well, thank you so much. And just for the listeners, APLS is antiphospholipid syndrome. So, we just in case, it's a pretty rare diagnosis. It's actually quite often associated with lupus. So, lupus is an autoimmune disorder that can affect all of your organs, really. Most of the time, we see it in the joint, in the skin. And then we can see kidneys involvement, but we have other organs that can be affected. And antiphospholipid syndrome is going to cause you clots. So clots in the venous and clots in the arteries. So that can be actually a real problem. And the other thing about antiphospholipid syndrome is the miscarriages that can either be frequent or after in the second or third trimester. So all this to say, because they are autoimmune, we have treatments. So that's the good thing, right? We have treatments.
Yes.
You can also see it from the really good side, which is we have amazing treatments now. So that's really important to realize. I think that's wonderful, Dr. Durowade, what you're telling us about the fact that, you cannot just do any contraception. So I think right now what's one of the little issue with rheumatologists is that they're getting really busy. And it's not just rheumatologists that are seeing rheumatology patients. There's a lot of advanced practitioners because, again, it's getting busy. And so make sure that you do talk to your rheumatologist to make sure that the contraception you want to take is safe. And then if you do not know, if your rheumatologist doesn't seem to know, make sure that your GYN is also, like Dr. Durowade, an expert in this, so that you know exactly what to do. I want to ask you, and this is not medical advice, so that's really important for the auditors to hear. Those are not medical advice because every single one of us is different. But
Right.
in general, what are the contraception that, like, just in general, like the types? What are the types that are safe for a patient with lupus or for a patient with antiphospholipid and that are
Um,
effective?
right. So in general, like you said, not for everybody because everybody's disease pattern is different. So the safest that we don't have any qualms with, we don't have any issues with, is the progestin IUD. So intrauterine device. So either the Mirena, the Kylena, the Liletta, the Skyla, any of those progestin IUDs are safe. They have not been shown to increase risk of any blood clots. They have not been shown to interact with any medications. They even make the bleeding less. So your menstrual flow is less. Let's say a lupus patient is on an anticoagulant, for example. Anticoagulant makes the bleeding more. And so if you're on anticoagulant and you're having a menstrual flow, you could be very heavy. The Mirena IUD or progestin IUD will make your periods less. So we really like the progestin IUD for in general, all lupus patients. And now there are people who they say they don't want foreign things in their bodies. People are like, oh, I have a family member who had a bad experience with an IUD. So there are people who are truly averse to it. We can use progestin only pills. So there are people who would, let's say, good disease, their diseases are low. They can take pills that doesn't have estrogen in it. So birth control pill, same time every day. Only issue with that is you might have like unpredictable bleeding, but there are some people who do very well with that. And the other one is the implants, the Nexplanon, the one that goes in the arm and lasts 3 years. That's also a good one. There's not a lot of data about the blood clotting risk or anything in lupus patients specifically, but we're assuming that because the pills are fine, then the implant will also be fine as well. But our favorite is the progestin IUD, then the pills, the progestin only pills, and then we can do the implants if they're really not doing well with either of those.
Got it. Oh, that's funny. I always wonder, like, when you talk to OBGYN, I feel like the Mirena or like the progestin IUD is like the one.
Yeah.
Is that the case? Because I didn't know this until very recently when I was on the physician mom group of Colorado, and every single
Yeah.
OBGYN was like, Mirena, IUD, IUD, like progestin
I really
IUD,
love it.
progestin.
I do, because it solves a lot more issues than just menstrual flow, than just contraception. It makes your periods less. It makes your periods less painful. There's some of my patients who I switch them from the copper to the Mirena, and they have 2 days of spotting, and they love me. They're like, "You changed my life." My periods are just 2 days now instead of 7 days of heavy
Wow.
flow and pain. And
Yeah.
so I'm not a fan of heavy periods or painful periods. I highly, if I could be personal, I got one myself because my periods were ridiculous and it was transformative. So I speak from a place of experience because I personally have it, and it lets my patients, trust me a little more and try it out. And then they love me after that. So,
Yeah, no, that's great. And if you are in the Illinois, Chicago area,
yes,
go
yes.
and see Dr. Durowade, because I feel like she has no problem making sure that that IUD is going to be placed properly without pain.
Properly. Yes.
Without pain. So that's really
Yes.
important. Well, so, the podcast is about hope driven by science. Well, you've already given us like one with this periods that were very heavy and you changed their life. But do you have any history of hope driven by science that, you want to share? Just a little tidbit.
Oh, that's a great question. And one of the things that I find a lot of is women don't know about bleeding after menopause or just really, really heavy periods. I have patients who come to me, they're like, oh, it's always been that way. My periods have always been heavy. And then they describe the periods and they're like, well, it's normal. And I'm like, Is it? So sometimes you have to ask people, is what you call normal normal? And so I'm like, let me just do a blood test. I'll just check your blood count. If your blood count is great, I won't argue with you about your periods anymore. And so I check their blood counts, and some of them, it comes back really low. Like they're going around with a blood count of 6. Normal is 12 to 15. They're going around with a blood count of 7. Actually, I had a patient that got a frantic call from the lab that it was 5.6. And so I got frantic, and I was calling her and telling her to go to the hospital for a blood transfusion. She was like, I don't feel anything. I'm like, well, let's do something before you do. And so she went to the hospital and got a transfusion. And she called me the next day and said, I didn't know how bad I felt. I didn't know how fatigued I was until I was not fatigued, until I was not tired. So, I mean, I think that, just having a conversation with your doctor, getting educated, even if you think something is fine, just bring it up and let's see if it's something that we can do something about. And so that patient, now we're looking into how to get her an IUD and make her periods lighter so that she doesn't get blood count so low.
Yeah.
And so I love to just let my patients know that there are solutions for their problems. It's not just take this medicine and go. There are solutions. Let's figure it out, and there are solutions for you.
Thank you so much. This was so
Yeah,
powerful. So,
thank you.
and that's true. I think that especially us, like in general, actually, women. I've seen women and men doing this where they are used to it. They get used to their
Mm,
pain level. They get used to their
mm,
symptom, and it's like you don't have to. Please, we're here.
exactly.
We're in 2023. We have treatments. We have things,
Mhm,
and sometimes we don't, and we tell you.
mm,
But most
mm,
of the time, most of the time, we do have treatment.
mhm.
Dr. Taiwo, can you tell us again where to find you, your website, if you have a social media platform? How do we
Yes,
find you?
absolutely. Thank you so much for the opportunity, Dr. Ami. I am on Instagram as Dadur, Dardur, gynecology. I'm on Facebook as Dadur Gynecology. I'm on YouTube as Dadur Gynecology. My website is dadurmedical.com, Dardur medical.com. And I have a lot of information there about birth control, menstrual periods, vaginal discharge, anything that that I see on a day-to-day that women have questions about. And you can contact me through my website or through a private message on any of those platforms.
That's wonderful. Thank you so, so much for being on the platform. I think that there was a lot to learn from today, really.
Absolutely.
And again, if you are in the Colorado area and you are looking for rheumatology that truly cares, that's going to get you to remission with treatment or without treatment, but we have amazing treatments. I am she. I am still, we are we have availabilities right now for new patients. So don't hesitate and contact us at info@unabridgedmd.com. I repeat, info@unabridgedmd.com. And we will see you next week. Bye.